Thank you, Dr. Shulkin. I'm sure I speak on behalf of many that are grateful for your years of service and the incredible telehealth infrastructure that you built at the VA. With that, I'd like to introduce TytoCare and give everyone who's listening a brief introduction to the company and the product that we offer in the marketplace today. Tyto is a company that was founded back in 2012, really spending its first 4 years of its existence researching and developing the product that you see here pictured in the image. We obtained our FDA clearance and approval towards the end of 2016 and began commercializing the product since 2017. So really just a few years in the market. Many different partnerships, both here in the US as well as internationally, working across health system organizations, payers, employers, among many other partners as well. In addition to the FDA, we are approved in many other parts of the world through our CE mark, Health Canada approval, and individual country regulatory approvals as well. What is Tyto? Tyto, as you can see there, is the industry's first all-in-one medical device that pairs with a virtual visit or exam. The base unit, as you see pictured there at the top, it has an LCD touchscreen at the front side, which is really the window into the examination data. And on the back end of the device has a proprietary ring connector that allows you to plug on a series of different adapters, like the stethoscope adapter for heart, lung, and gastrointestinal sounds, the otoscope adapter for ear exams. It's actually a very unique otoscope. It's the industry's first flexible tip, which is patented by Tyto. Very easy to navigate into your own ear or to your child's ear for that matter, or a patient's ear, and really anyone's ear. And it also has the ability to put on disposable speculums similar to other standard otoscopes. The tongue depressor attachment capturing a good looking throat. Those also have blades that come right off. Those are disposable or reusable depending on the use case that you're using it for. And then on the back end of the device, in addition to that ring connector, we also have a built-in exam camera for external imaging of the skin for example, and two LED lights that support that camera, both on the left and the right-hand side, to give you the most optimal lighting per exam. And lastly, we have a built-in IR thermometer for temperature, which simply can be held about 2 inches away from the forehead to get a real-time temperature reading. So with that in mind, I just wanted to kind of give you all a flavor of how this actually works. So to give you a flavor of that experience, this is actually a live telehealth exam here. In this case, it starts out just like a standard audio-visual experience, but the provider uniquely has the ability to connect to the Tyto device that exists in this female's home. She has a cockpit of all of the, he has a cockpit of all of the different types of exams that he can ultimately complete with this patient. And on the patient side, they also have a split screen similar to the provider, and being able to see them and also be navigated throughout this exam process. The provider can listen to different points, tag those, record those, can even amplify the sounds, or even use that drop-down filter to toggle between the bell, the wide, or the diaphragm filter, depending on what it might be that they're listening for. The next exam the provider will do here is the ear exam, where they'll get a glimpse into the ear here. They can choose to record. They can also adjust our optimal lighting settings as they see fit for that particular ear. And we also have two video streams in there with the patient, one that's giving you that view of the ear or the throat here, but also one that's giving you a view of the patient and their physical state, so that you can help course correct, for example, if they're incorrectly doing the exam. And lastly, they're going to wrap up here with a temperature exam, and within a few seconds here have a real-time temperature reading. So very easy to use, and again, meant for use, for example, by someone who's not clinically trained like this patient or this consumer. With that, as a transition and really into the topic that we're really focused on today is how do we focus on easing the burden on providers and preventing exposure. COVID, as we all know, it is a unique beast. Unfortunately, it's a virus that is very easily spread, including when it's asymptomatic. And a lot of clinicians and physicians, unfortunately, have been exposed, and some of them have actually tested positive, but many of them will want to continue doing the work that they love to do in helping patients and consumers. So I want to give you a few real examples of how Tyto and telehealth in general is really being used today to protect this type of exposure. As you can see here, the first use case really being ED triage, whether that's set up in, for example, some of these tents that have now been propped up across the country and some of the hotbeds that we've seen come up, like Louisiana, for example, or New York or California, but also using this technology as a triage mechanism, even in the inpatient setting as well. So thinking about virtual rounding, where a nurse could potentially go into the room with the patient that's tested positive, but also connecting to respiratory therapists, pulmonologists, cardiologists, really any of that care team that that patient may need. Senior care facilities, obviously elderly populations have been hit quite hard, especially those with underlying conditions. So with that in mind, really limiting the in and out of those senior care facilities and making sure that you can triage at those sites and still provide those elders with the care that they need and limit the amount of outside exposure that they would need to ultimately make depending on their physical state. Quarantine patient monitoring, this has been absolutely tremendous. Being able to send out a device into a patient's home, both from the perspective of those that have either tested positive or may have not even tested, but simply have the symptoms, and actually monitor their physical state over that 14-day period, ensuring that from a peace of mind perspective, the patient, number one, doesn't have to potentially go into the office, but number two, also can get that same level of clinical quality from their comfort of their home. And also thinking about this as part of a discharge process and really ensuring that the right people are in the right place at the right time. Lastly, I think we all can agree that virtual primary care is really going to be kind of the next wave of care delivery. And so we've seen a huge move by a lot of our health system partners to moving to virtual primary care models, even shifting roughly about 25 up to 50% of their visits for wellness checkups, primary care visits, as well as even specialty consults that now allow them to do a lot of what they would do in the in-office environment. We know physicians are generally more conservative, therefore they do still very much rely on those clinical tools that they're accustomed to using in their in-office environment. So this is absolutely critical for provider buy-in as well. I wanted to provide a few examples of how Tyto is being used with real system and real environments. So Kaiser Permanente, being on the West Coast in one of the more impacted regions in the country, as you can see, is using it for a lot of what we had just discussed: inpatient specialty care, urgent care, ER, as well as the senior living facilities across the northern part of the state and the Northwest region. Avera, being one of the larger systems in the Midwest, utilizing this across many senior living facilities. Novant Health, that has introduced this into their market and is delivering top-notch primary care virtually with the capabilities of the product. And as I had shown you in a previous image, Sheba Medical Center, one of the more renowned systems in Israel, using it for exactly that use case, the quarantine patients in their home over that 14-day discharge period, as well as remote consult. With that, I'd like to just take a quick few seconds in introducing April Radford, the Vice President of Telemedicine, as well as Dr. Nikolic, who is the lead over at Ochsner over the virtual care group. She's one of the executive medical directors there. Ochsner Health System has been a partner of Tyto's now for a couple of years, and they've really been on the forefront of using telemedicine across not just only primary care, urgent care, but thinking about what this can mean across many specialty lines. So I'm honored to have both of them here today and give you a flavor of what they're working on. Thank you.
Thank you, David, for having us. I'm April Radford with Ochsner Health Systems Telemedicine Division. I'm here with Dr. Aisha Nikolic. We'd like to talk with you a little bit about what our COVID response has been, the way we think about virtual care and how it's been a tool for us to protect both our patients and providers, and then think a little bit about what it's going to do for us in the future. I'll start by just talking a little bit about our broad response across the Gulf South with COVID-19. We're a comprehensive telemedicine division offering care not only to patients in the home and office, but also in the hospitals and in other clinics. And as a response to COVID-19 across the Gulf South, we've been able to help care for both our patients and our providers by increasing the training, allowing more providers to offer virtual care. As an example, we have more than 2,500 providers now who are using MyChart video visits. We have more than 300 providers in our virtual provider network who are doing on-demand Ochsner Anywhere care services. And then also the response to needing tools to deliver virtual care has been quite important throughout this response. Not only from our Ochsner Health Kit powered by Tyto, where we're caring for patients in home and in the office, but then also what we're doing in our hospital and acute care spaces. And as a result, we've deployed more than 300 devices into health facilities to help care for patients there. Another tool that kind of bubbled up from our care teams as a desire to help our patients feel more comfortable is a program called our Family Connect. As we had patients in the hospital who were isolated or quarantined and in our facilities, we noticed that the care team was really becoming more of their family because we had reduced significantly the visitation from outside providers as an effort to reduce exposure to many folks, including families. So the Family Connect program was a way for us to be able to bring peace of mind not only to the patients, but to the families by allowing them to connect with each other.
And this is especially important with COVID-19 because of the extreme isolation, not only for the patients, but also for the family.
That's a great point, Dr. Nikolic. Let's also talk about how we use the tools to protect our families and our providers and our patients as well. About 2 years ago, we started our journey with Tyto. That was really an effort to, one, look for a diagnostic tool that complements the virtual care and the diagnostic abilities in the home and in the office. It was also a way to bring our patients and providers a little bit closer to appreciating what virtual care could do with them, while also offering peace of mind that a standard of care could be met.
And that's a great point. So as a provider, every tool that is a new tool needs to be a useful tool. And so when you are doing a virtual visit, if you're just going to see somebody, there's a limitation as to what you can do. Whereas if you have a peripheral where you can get some hard data, that'll help you expand your diagnostic abilities and counseling abilities with those patients.
Absolutely. So about 2 years ago, we started on our journey. We named our Tyto Care Kit the Ochsner Health Care Kit. And we partnered that with our 24/7 urgent care service. So our full stack looks like this. You start your visit, you do a Tyto or an Ochsner Health Kit exam. You can reach out to your provider 24/7 and have an urgent care appointment there where your provider can see the different diagnostics or the vitals that you've taken. And then within minutes, you can have a prescription called in to your pharmacy and also delivered to your home.
We were very foresighted with the COVID pandemic now, because really with the delivery to home, it decreased the number of times that the patient needed to go anywhere. So you kept the patient safe at home, decreased transport time to a healthcare facility where there were potentially other ill people, and then also decreased any contacts in the pharmacy location. So overall, it truly was a full stack solution.
Yes, and I think what's so great about having had this in place is we had an opportunity to work through it, get comfortable with it, onboard providers, so that when COVID presented, we were more readily available to have a service in place that would keep patients at home, offer our providers some frontline offense to being able to treat patients and keep the spread of the virus down. This slide basically shows the growth. You can see there on the left side what we call our 24/7 Ochsner Anywhere Care, which is the on-demand urgent care service, has really seen some increase in the visit volumes there. Prior to COVID, we're averaging about 15 patients per day. And you can see here in the graph on the left-hand side that we're getting a little bit closer to 260 patients per day. What was very nice about this, we talked a little bit about adoption early on, is that we saw a tremendous increase in providers wanting to participate in offering on-demand care. And as a result, we were able to grow our virtual provider network by more than 200 providers here.
And already having that platform in place where the patients were comfortable with the platform before the COVID crisis, where we had already worked out workflows, growing from 40 patients a day to 400 patients a day really wasn't very difficult. And again, it's a tool. Luckily, we had that tool in place beforehand, and it was just a question of good marketing. And thanks to Corona, that marketing happened. And I tell people all the time, during Katrina, everybody learned how to text message. During Corona, everybody's going to learn what virtual care is about.
Right. So, and I think the graph on the right-hand side really demonstrates that well, too. The immediate ramp that we had in our MyChart, which are our scheduled virtual visits. These are the ones we're doing with primary care and our medical and surgical specialties. We virtually trained more than 2,500 providers, both within our care teams and the community care teams, to use this virtual tool for patients. And you can see here that at the beginning of March, we were, doing probably 20 to 30 patients per day. And where we are just in the last couple of days is seeing more or completing more than 3,500 visits per day. And as you look across the next 30 days, we actually have more than 14,000 appointments scheduled in MyChart video visits going forward. Let's just talk about what's happened, with the Tyto journey here too. The home sales prior to the COVID, for example, we did 1,000 devices sold last year. As a result, this year, within a couple of weeks time frame, we've sold now about 2,500 to 3,000 devices in just a few weeks. That is a rapid increase in sales. It's a significant increase in patients and providers wanting to be able to use the tools. And as a result, you can see on the right-hand side that the visit volume, is also tracking that. It's not just that they purchased the device, but they're actually using it now with their virtual visit service. So, Dr. Nikolic, I'm going to give it to you, and I'd like you to make a couple of comments here as we move into the next slide. We've done this from an employer perspective, right? In 2019, we have about 15 partners there. The employers began to increase their adoption of virtual care. With COVID now, they're more interested now than they were before. You can see in 2020, just in the first 4 months alone, we've done 38 employer partners. And as a result, I think, we're touching 70,000 more lives all in the last few weeks, right? I'd like you to take us through how have we thought about using the clinic tools differently?
So, you brought up a few good points. Buy-in is the key thing. So having that familiarity with the tools on a patient side, on the employer side, on the provider side, on the system side has been huge. And the way you can get your providers to buy in is to show the benefit. So like I said earlier, you have a virtual visit where you can just see somebody virtually. It's a video visit. It's live. You can interact. You can definitely see what their mental status is. But to augment that with the Anywhere Care Health Kit, which has the Tyto kit, which is a high-resolution camera with a thermometer. It's got a stethoscope adapter piece. It's got a tongue depressor adapter piece, and it's got an otoscope adapter piece. You can couple it with a pulse ox as well as a blood pressure cuff. That gives the provider more tools. So particularly in this pandemic where we're worried about breath sounds, we're worried about oxygenation, we can give that patient a little bit of comfort and the provider some comfort saying, look, your ranges are within normal limits. The other thing that's been interesting is we've used this tool in onboarding and training of new providers, whether it's young residents, fresh out of medical school, or mid-level providers, APPs, that are starting to work in the acute care clinics, by being able to show exams to them, video those exams, and then play them for them and look at it. So I always remember the first time I used an otoscope, which is a tool. It's a little older than the Tyto kit. And the first time the doctor that was teaching me said, oh, do you see that ear? That's the eardrum. And it's red right at the bottom. And I looked in there and I didn't see anything. But now when I teach, I can actually show them that red eardrum. And then you take it a step further and you're talking to the patients and you have a worried mom on the other side. And she says, you know, I know this is an ear infection. And she does the Tyto visit. And you can show her on the video, look, the left ear looks just like the right ear. There's no redness. This is what I look for. This is the light reflex that I'm looking for. There's no pus behind the eardrum. That ear looks perfectly fine. And that has really spurred us towards antibiotic stewardship, where we've been able to cut back on the number of unnecessary antibiotic prescriptions with patient buy-in.
Yeah, so talk a little bit too about how we've done that within our clinics now. So we've had a couple of employer clinics, as you saw on the previous slide, and now we've shifted into this very fast and furious COVID response. And what do we do now with our Tytos or our Ochsner health kits in our clinics?
So the number one thing is to keep everybody safe, whether it's the patient or the provider, the MA, the front desk person that's checking the patient in. All of those people are still lives that we're trying to protect. And the big push was to try and keep the patients home and care for them at home. So we started that with the Ochsner Anywhere Care platform, where the patient could have a video visit with the provider. The provider could then assess, is this somebody who's stable, who's unstable? If they're stable, do I need to get them tested? Is this somebody that I need to be able to monitor? Ochsner has a fantastic home monitoring program as well that sends the patient text messages daily to check in with the patient to see how they're doing for 14 days after the provider marks them as a COVID risk patient. If the provider decides that the patient needs testing, then they can send them to a testing facility with the instructions of staying in the car, letting the facility know that they're in the parking lot, and then the MA can come out in full PPE and only touch that patient once while they're in the car. That way that patient's not exposing anybody else, and they can get their testing done. We took it one step further with the Tyto clinics in the actual urgent care clinics and the emergency rooms, where if a patient in and they were deemed risk for COVID infection, we put them in a room with the Tyto clinic in place, where they could do the virtual visit with the provider there. This worked really well for patients that didn't have smartphones and that couldn't do the Anywhere Care visits from home. So they could go to a facility, they had all the peripherals there, they had a visit with a physician or an APP, and then if the APP felt, or the physician felt like they needed further testing, whether it was a chest x-ray or they needed to get swabbed, it limited the number of times that that patient would have to be in contact with the MA, the x-ray tech, or the physician. So, for example, a patient comes to the Tyto room, the physician walks them through the exam, and then says, okay, so I do want to test you. Let me get the MA in there to test you, and then we'll call you with the results, and here is what we need you to do at home. We'll set you up with the home surveillance program. The MA only needs to go in once in full PPE, swab that patient, discharge that patient, and that's the only touch point where we had potential for infection. So it helped decrease a lot of the anxiety for the staff. It helped protect the providers. Our frontline staff, as everybody's frontline staff, is our most valuable tool. And we wanted to have something that would help keep them safe as well as the patients safe. One of the biggest things that virtual medicine has seen across the country is the number of providers that have been furloughed or quarantined, and the ability to take those and load balance those providers and not have to furlough them or lay them off has been the virtual platforms that we use at Ochsner. So between the Ochsner Anywhere Care platform, the systems we have in place in our EICU, our telesite, we've been able to use our providers that may not have been safe in the front lines with patients and be able to use their talents and their knowledge to take care of patients. Same goes for the other way, which is the patients that were worried about coming in and but still wanted to be seen. This has allowed for another tool for them to see their providers that they usually saw and not lose that touch or continuity of care.
Yeah, I think this is going to change the way we do medicine going forward. Just to talk a little bit about, what we've seen in adoption and buy-in from our patients and our providers. More than 50% of our outpatient clinics are virtual care right now. We're going to see this become a new way of delivering care. I think we're going to also see our patients have a different level of expectation. It's going to change the dynamic of the discussion about how would you like your return visit to be scheduled, right? At the same time, I think this has quickly forced us into making decisions about standard of care and how those should be conducted during virtual cases or virtual delivery. And the tools that we've had available to us have really allowed us to do more than what we could have done had we not had tools in place. So I think that's going to change for us to the future as we transition, or we'll have a transition period of during COVID now to like partly in COVID and transitioning out, and then what we look like after COVID. I think additionally, the value of virtual care is changing as we go through this event and this crisis. I think from our patients, we've seen an appreciation for access and convenience, but also the safety that they have and not having to come in for routine exams or other things and risk some exposure. I think our providers have appreciated the same thing, and yet also they're thinking through, well, I could deliver virtual care and I could be in a different setting as well. And so how are we thinking differently about, the structure of our clinics and the number of exam rooms needed versus can we have providers even working from the comfort of their home with professional backgrounds and still delivering care? And then from a payer perspective, I think I've personally seen our conversations change significantly in those arenas. And now the payers are coming to the table wanting to make sure that there's continuity of care for their patients, that the telehealth benefits are going to allow some alignment with the health systems where there's some continual follow-up and they're seeing providers that are already in those payer networks. And then I think on the behavior change, I think some of that's obvious. We're now thrusted into virtual care, but how do we think about hardwiring that going forward, right? So this is not just an incident response. This really becomes the way we deliver healthcare going into the future and beyond. And so that, for me, looks like how do we hardwire these type of virtual appointments into our clinic? How do we make sure that we're set up with the right integrations and the abilities to use the diagnostic tools like the Ochsner Health Kit, in any one of our services, including in the hospital setting where we have a telestroke or a telepsychiatry, but we need vitals on that patient, or in another clinic like you've seen previously with in the previous slides with the Tyto clinic. The consistency for you as a provider, Dr. Nikolic, being able to deliver care in the clinic, in the patient home, and potentially into an emergency room per se, how important is that to you in not having to get adjusted to a new tool each time?
So I think that's one of the beauties of having an EMR that goes across our entire system, where I can see patients in different clinics and always have the EMR at my fingertips. It's the same tool I'm using. And that's the same way I feel about any peripheral. If every peripheral is different and I have to learn how to use one camera versus another camera, or one platform versus another platform, or one stethoscope versus a different stethoscope, it gets to be challenging. I like to have my routine and know what I can do, and know what the pros and cons of my peripherals are, and really get to know them. And that's true of any tool. You know, if we look at the vacuum cleaner you have at home, you pick the vacuum cleaner that works for you, and you want that vacuum cleaner to do the best job for your entire home. You don't want a vacuum cleaner for the bathroom and a vacuum cleaner for the bedroom. And the providers feel the same way. I think the big thing that really has impressed me is the provider buy-in through the COVID crisis. I think that the patient buy-in was logical to me, because who wants to go to a clinic and sit and wait for an hour to see a provider for 5 to 10 minutes? And I think that the quality of that interaction, even though it's 5 to 10 minutes in the clinic, is perceived as higher quality when it's face-to-face time without a mask, with a physician or APP looking at you and really interacting with you in your comfort zone. And it takes away some of that anxiety of going to a clinic that existed even beforehand, before Corona. People didn't like going to the doctor. They didn't like waiting in the waiting room. And I think that'll lift a lot of that. So behavior change is going to be has been helped a little bit with Corona, but it is something that the longer we do it, the more natural it's going to become, just like anything. And I think that if somebody told me 20 years ago I'd have a phone that has GPS on it and I could take pictures with it, I would have told them that wasn't going to happen. But I think now we all see that we had to accelerate quickly, and thanks to the tools we had in place and the foresightfulness, we really could go through this crisis without letting our patients down or our providers down.
And with that, we'll pass it back to David for some closing remarks about how this will change for the telehealth industry altogether.
Thank you for having us.
Thank you.